No one can tell Joanne Zeis what has been causing her painful eye, joint, and skin problems. After 7 years of suffering, her symptoms show no sign of letting up. Then, one morning, something terrifying happens.
There was one day that I was working, and I remember looking down and I did a double take because I wasn't seeing something normally.
She was working as a graphic artist. She was a forms designer.
And I looked down at the page, and what I was seeing was the letters that were appearing on the page appeared broken. The lines of type themselves were wavy. And I was horrified. I picked up the phone and called my eye doctor. And once I finished describing it, he told me, "You have to stop what you're doing and come in now."
Joanne races to her ophthalmologist's office. The doctor thinks there is something wrong with her retina. He performs a test called a fluorescein angiogram, where an orange dye is injected into Joanne's veins to better photograph the blood vessels in the retina. The results are frightening. A few vessels have ruptured, and blood is leaking into Joanne's central vision, blinding her left eye. The only hope is emergency laser surgery, but that too is risky.
He said, "I'm very good with a laser, but I can't guarantee that when I hit that area with the laser to seal off the blood vessels that I'm not going to destroy your central vision at the same time." I'm thinking to myself, either you can not have this surgery done and watch your vision go, or you can take a chance. He'd do it right. So I signed my life away and just started praying that he'd hit the right spot.
Fortunately, the laser surgery is a success. The hemorrhaging blood vessels are sealed off, saving Joanne's vision. But her recurring symptoms still show no sign of diminishing.
To not know what you have, not know how it's going to develop, and not know if there are any treatments available for you, it must be devastating.
I really kind of reached my boiling point in terms of how much longer was I going to be able to put up without having a diagnosis.
Joanne takes matters into her own hands. She makes a list of all her symptoms and searches for anything that will tie them together.
I said, there's got to be some reason why I have all of these things. So I spent so much time on the internet at that point. It was ridiculous. I started plugging in all the different symptoms that I had. Eventually I narrowed it down to a few possibilities, but I couldn't get any doctor to agree that that's what I might have.
Then, in the summer of 1997, Joanne gets another chance. After finding out that she's developed a cataract, she's referred to Dr. Stephen Foster, the same specialist who diagnosed her 17 years earlier with uveitis, or inflammation of the eye. She brings her list of symptoms to the appointment.
You know, I had my ideas about what might be wrong, but I wanted to hear from him what he would think a diagnosis would be. So I thought, well, I'll just hand it to him and see what he thinks.
She pulled out of her purse a relatively long list of many things that had happened medically.
He was amazed at the progression of symptoms.
Joanne, over those 17 to 20 years, was not leading a normal life.
He'd only seen me back then when I had just the eye problems and a little bit of the joint problems, but not this entire list of things.
Literally within seconds, it became clear what this was all about.
He just looked up at me, and then he said, "You know, I do know what you have."
Well, one of the most prominent signs and symptoms was recurrent canker sores. A lot of people have canker sores, so that in and of itself does not the diagnosis make. But when one couples that with the recurrent skin lesions plus uveitis, it becomes instantly obvious that this is Behcet's disease.
Behcet's disease is a rare disorder that causes inflammation of blood vessels throughout the body. When a blood vessel is inflamed, it can irritate the area around it, leading to oral ulcers, skin lesions, joint pain, and recurrent eye inflammation. There is no cure, and the exact cause of the disease is unknown, although it seems to be most common in people of Asian and Mediterranean descent.
Currently, approximately 25% of patients with Behcet's disease with eye involvement will be blind inside of 5 years. It's not curable, and why blood vessels in the mouth or on the skin might be affected today and blood vessels in the back of the eye might be affected 6 months later is not at all clear.
I'd come across the name Behcet's already, and I was leaning towards saying, well, that's probably what I've got anyway. But I needed to hear it from somebody who was an expert in it. And to me, that was like shining a spotlight in a dark area because I had waited so long for somebody to tell me what I had wrong with me.
Dr. Foster is the one that unlocked that key, and in a way, it's like removing a mask.
Finally had a name. Now she could do something about it.
Dr. Foster puts Joanne on a long-term treatment using an anti-inflammatory drug that can prevent flare-ups in the blood vessels of the skin, joints, and eyes. Today, Joanne's Behcet's disease is in semi-remission.
Actually, I think Joanne's long-term prognosis is excellent.
It has been quite a while since she's had any symptoms at all.
But for 17 years, Joanne suffered, which is not uncommon for people with Behcet's.
There's no test. There's no Behcet's test. It's not as if these things spring full-grown. They evolve through time. That was the case with Joanne. The first thing that began with her were the aphthous ulcers or canker sores. And it took a long time for other things to slowly evolve to the point that now it's clear. It doesn't last forever. It does have a life to it, a beginning, a middle, and an end. And I think Joanne's is on the back nine. I think she's going to be finished with this long before she's ready to say goodbye.
Today, Joanne no longer works as a graphic artist. She has dedicated her life to raising awareness for Behcet's disease.
I didn't want anybody else to have to go through 17 years worth of a nightmare like I did. And as far as I'm concerned, that's the main thing in life. If you can help somebody else, then do it.